Hi, Rhiannon.
Hi.
It's nice to see you again.
Yeah.
So, I've seen you a few times in the past, not a lot, but you're 30 years old now, and I got a prescription to treat you today for low back pain and SI pain. You want to tell me about that? Like where it hurts, if there's anything that's like going down into your leg at all?
Yeah. I'm getting constant low back pain,
Okay.
and then and also intermittent pain down into my buttock.
Okay.
It's a 3 out of 10 pain.
Okay. When did this happen? Or like, was there like something that you were doing?
Yeah, I was lifting a heavy box off the floor into a
Okay.
moving truck.
And then
So
ever
that's when
since
it
then,
happened.
you
Yeah.
had that constant back pain?
It's that was 10 days ago when that happened.
Okay.
And recently, and when it gets pretty bad, I take a leave.
Okay, you've been taking a leave. Okay. All right. Well, do you mind if I get you up on the treatment table and show you some tests that our profession uses to try and like figure out what's going on with you?
Okay. Yeah, that sounds good.
Sure. All right. Let's have you hop up on here. We'll have you up on the back. Okay. So this first one here, I'm just gonna have you bring your leg up here like this. And you can take stuff out of your pockets if you need to. Just gonna slide my hand in right underneath here, right kind of where you're having your pain. That's right at that SI joint. That's what I'm suspecting here. And now I just want you to let me know if you have any of the pain down your leg or pain in your back in that area that you were describing earlier when I do this. Okay. All right. So I'm just gonna push down. Does that kind of hurt a little bit?
Yeah.
Okay. So what we would say is that's a positive test since you had pain.
Okay.
I'm going to move on to the next test now. Just kind of scoot over to the edge of the table here. Let this leg hang off the edge. And we're going to bring this one up. Same thing here. Let me know if you have pain at all associated with this test here. I'm going to push down on one leg and push back up into you with this leg. Any pain there?
No.
Okay. So with that one, I was kind of taking your pelvis and I was twisting one side forward and one side back, and you felt good on that one, so that's good deal. That's what we want. Okay, now scoot over just a little bit towards me. All right, we're gonna work that same area again now. This is gonna test the anterior ligaments of your SI joint. Just let me know if you have any pain that comes along with this test here. I'm going to push down and out, kind of. Any pain with that?
No.
Okay. Can I have you roll over onto your side next? Okay, same thing here. I'm going to push on your hip bone again. Just going to push down.
Yeah, that hurts.
That hurts? Okay. All right, so I found a positive for your ASIS. This is called the ASIS compression test. The last one we did was called the ASIS gapping test. And I want to do one more test with you. Go ahead and roll over onto your stomach for me. This one's called the sacral compression test. And I'm just going to find your sacrum. Do you know what your sacrum is?
Yeah, it's this part of my spine that's lowest, yep.
Yeah, kind of like your tailbone. So I'm just going to push down on there with two hands. Same thing. Let me know if you have any pain with this, okay?
Yeah.
You've got some pain with that? Okay. All right, you can go ahead and lay however you feel comfortable. I'm just going to describe kind of what I found to you. So I found, out of those 5 tests that I did, I found that 3 were positive. So we have some prediction rules that I'm going to review with you and the camera here. There's a cluster of tests that we perform in our profession. And so the first cluster includes the thigh thrust test, the gang slings on the left and the right leg, ASIS distraction, the ASIS compression test, and the sacral compression test. So if I found that 3 out of those 6 were positive, then I could rule in a SI joint diagnosis for our patient Rhiannon. There's another cluster of tests that consist of the ASIS distraction, the ASIS compression, the thigh thrust, the Faber, and the Ganson's test. And if 3 out of 5 of those are positive, then we can also rule in an SI joint diagnosis as the cause of the pain. So for that second cluster that included the Faber test, now I will show you guys that test next. Rhiannon tested positive 3 out of 6 of the first cluster of tests. Now to determine if we can rule in an SI joint diagnosis according to the second cluster of tests, we'll do the Faber. So for the Faber, Rhiannon has his ankle up on his opposite knee, and I'm going to stabilize right over your hip bone, and then I'm going to push down on your knee. Let me know if you have any pain with this. Any pain there in that same area that you've been having your pain?
No.
Okay. So he didn't test positive for that, so we only had 2 out of the 5 tests positive for that second cluster of tests. However, you did have a positive grouping of clusters for the first group.
Mm-hmm.
So I'm going to try and do some stuff with you now that's going to focus on that SI area. Hopefully we can get you feeling better again like we have in the past.
All right. That sounds great.
Okay.